Welcome back to Insight. We're here with Aging and In-Home Services of Northeast Indiana. Todd has joined us. You're a family caregiver specialist, right?
Correct.
So we're going to talk now. Beth, you were just talking about behavior as a form of communication because that's how we communicate with our behavior. Talk a little more about how you can help the caregiver when they're dealing with these behaviors that maybe aren't socially acceptable or ones that are frustrating to them that are not indicative of how their family member with dementia would normally behave.
Yeah, so we assist in a variety of ways. We have monthly support groups and guided discussions, and our educational guided discussions help us to teach the caregivers valuable tools. Some of the slides we've shown and a few more that we will show are from some of those sessions that we've had. And related to challenges in dealing with behaviors, we try to help the caregivers understand that they need to accommodate the behavior as opposed to trying to change it. So this is an example on the slide here, is a way that we help caregivers to identify what they're seeing from their care recipient, which isn't always obvious,
right? And
then adjusting how they can deal with what they're seeing, because ultimately we have to teach the caregiver to learn to manage these behaviors because the behavior is not going to change, so we have to adapt to it.
Because really, once someone is in that dementia stage, once they're dealing with dementia, probably not going back. You're going to continue to deal with it, right?
Right. It is a progressive neurological disorder, so the ability for someone in the mid to later stages of dementia to learn something new is just not there any longer. So we're learning that the best way to help a dementia patient is through helping the caregiver and helping manage those behaviors in a less stressful way so that they can maintain staying in that home as long as possible.
You've worked with Rosalind Carter has a program, right?
Yes, and so I've worked with this evidence-based program. It's called REACH. It's an acronym for Resources for Enhancing Alzheimer's Caregivers' Health. And it's designed to teach caregivers to learn how to identify those behaviors, manage them, but it is a person-centered program. So you are one-on-one with that caregiver. You can help them work with what they are seeing and help them to kind of dive into that and to develop approaches to best deal with them in their caregiving journey with that specific loved one.
Because, and I have seen this firsthand in my own family, caregiving for someone with dementia is so stressful to that person that's taking care of them.
Absolutely, and studies have shown that caregiving for a person who has Alzheimer's, we find that caregivers are 7 times more likely to experience physical, emotional, and mental exhaustion than those who do not have, than those that are caring for someone who does not have dementia. And they're 3 times more likely to feel extreme stress from caregiving responsibilities than those who are not.
So Todd, as a family caregiver specialist, how are you helping these caregivers deal or teaching them to deal with that stress?
Okay, so recently I went to a training in Indianapolis. It was a 3-day training, and it gave really good specific ways for caregivers to handle difficult behaviors with their loved ones. And so we have support groups. I'll go out to their home, I'll work with them, and I'll connect them to other agencies in town that can help them even more.
The Indiana Department of Health is helping you guys.
Right. They're providing trainings for persons that have long-term needs, including dementia, through the University of Indianapolis. Correct.
How do you figure out what the stress level is of caregivers?
Okay, so when I go out to a person's home, a caregiver's home, I'm going to talk to them about things such as, are you maintaining your social relationships? Are you still engaged in social activities? Are you still enjoying those things that you used to enjoy? Are you experiencing any sadness, depression? I talk to them about that, and then I give them kind of a self-evaluation form, and through that form, we even talk more deeply about their feelings about caregiving.
Well, I want to continue this discussion because that caregiver stress is such a big deal, and it can certainly affect their health too. So we're going to talk some more about this. Stick with us. We'll be right back on Insight.